Hello, hello, hello. I'm Christy Abel, certified sexual health educator, high school counselor, teacher, and mama. Today, I'm here to share some information about incurable STIs and blood-borne illnesses. And these include HPV, hepatitis B, genital herpes, and HIV/AIDS. All of these are spread in the same way, which is through unprotected oral, anal, or vaginal sex. And also, infected mothers can infect their baby during the birth process. They are all incurable, which means that they stay in your body for the rest of your life. They can, however, be managed with medications and lifestyle choices. Because each one of them is quite a bit different, I'm going to look at them individually. Okay, so HPV. There's over 100 different types of HPV. And when they show up as an STI, which is a sexually transmitted infection, okay, they show up as genital warts, which are these cauliflower-like bumps that may appear weeks or even months later. But some people will have no symptoms and will just carry HPV with them. So there's no cure, right? It stays in the body, but symptoms can be managed with medication. However, most genital warts will go away on their own. There are a couple of vaccines available. Gardasil or Cervarix are two of the most popular that can help prevent the most common types of HPV. Now, if there is no treatment or no vaccine, it can cause a lot of distress, right, to find out that you are HPV positive. However, about 80% of people who have unprotected sex will contract HPV at some point in their lives. It can increase your risk of other STI BBIs if you have it. Now, it can also lead to cancer, right? Some of those types of the 100 different types, some of them will actually lead to cervical and other cancers. Okay. Next up, we have hepatitis B. Okay, so symptoms for Hep B will start to develop between 45 and 160 days after exposure. And they are like flu-like, so fever, tired, body aches, stomach pain, nausea, but also there's a jaundicing of the skin that typically comes with it, which is like a yellowing. Okay, so if you start to look like a Simpson, this might be a clue. Okay, so treatment is there's no cure again, right? But you can prevent it with a vaccine. It's very, very important to get all your hepatitis if you're going to be traveling to less developed countries. Of course, though, you can get Hep B anywhere. Now, if you leave it too long without getting any type of treatment, chronic infection can lead to liver inflammation, cirrhosis, cancer, jaundice, and death. So kind of a big deal, right? And this virus is very, very infectious, and it can survive outside of the body for at least 7 days. All right, next, genital herpes, which is also very common. About 1 in 5 adults is carrying the herpes simplex virus, as otherwise known as HSV. Symptoms will typically appear 2 to 21 days after sexual contact with an infected person, and the first outbreak is usually the worst. Now, this is one of the things where condoms might not be enough, right? Because people can have these sores elsewhere like they can have them on their inner thighs, they can have them in their pubic hair. So it's very, very important that you do a visual test, okay, as to whether or not someone is currently having an outbreak. So what we see here are blisters, which are small fluid-filled sores, a burning sensation when peeing, okay? Anytime that it burns when you pee, you need to see a medical professional. This ain't going away by itself, yo, okay? Burning when you pee is a significant thing that something is wrong. It might not be an STI, but something is wrong, okay? So burns when you pee, automatic doc appointment, all right? Okay, there can be itchiness, there can be enlarged tender glands, right? When I feel like we're getting sick, our lymph nodes get all uppity. Now, recurring outbreaks can be triggered by all sorts of different things. Okay, so emotional stress, sometimes exposure to sunlight, hormonal changes like a period cycle, poor nutrition, even having sex, sexual intercourse can bring on outbreaks, lack of sleep, or even a low immune system. Okay, once again, that's the theme of this video, is there's no cure for any of these, but you can manage symptoms of herpes. Again, 20% of the adult population is walking around with this, okay? It is nothing to be ashamed of, but I will talk in a minute about how we need to be transparent with our partners, all right? Now, risks of no treatment for herpes, HSV, is brain damage and blindness in babies born to infected mothers, okay? So this is something that would happen to a fetus, and it also increases your risks of contracting other STI BBIs if you do become exposed to them. All right, and HIV/AIDS, which is honestly, I think the biggest deal. This HIV, so I'm a child of the 80s and 90s, and it was right at like the onset of the AIDS epidemic, and man, we did get a decent amount of education around it, and people were dying, so it was scary, right? So I have another video called Condoms and Dams and Lube, oh my, where I share a bit more of that story. And it's just so important, okay? That in order to prevent this, or have safer sex, at least prevent it as much as you can, because of course there's other ways to contract it other than sexual activity, but that is the number one source. Now with HIV is the virus, and then AIDS is the disease that happens after. Okay, so HIV can live in your system for several years without any symptoms, but some of the symptoms that you might find are weight loss, tiredness, fever. Okay, so HIV causes AIDS. What it does is HIV weakens your immune system. I'm not going to get too into all the things. You can just look it up. There's so much information about it, right? Just Google what's HIV. Basically it causes your immune system to become very weak, and then it can't fight off other infections. So like somebody who was HIV positive would have been extremely cautious about COVID, right? Because COVID would be like it's game over, right? Now there are some treatments available, unlike back in the 90s. There are some treatments available, but there is no cure. So risks with no treatment, you have that weakened immune system, more infections and death, and of course the ability to perhaps spread it, right? To spread it. It's still a crisis in the world, okay? It's still very, very, very much here. Even though it's not in the news all the time like it was when I was a kid, it's still here. Okay, so for prevention for this, we want to use a condom and or dental dam every time you have oral, anal, or vaginal sex. You want to get tested at your local health center at least once a year if you're sexually active under the age of 30, and get tested at your local health center every 3 to 6 months if you or your sexual partners have more than one partner, okay? Even if you're using condoms, it is so advisable to go in and get tested. It will provide you with peace of mind, but also you will know right away, right? And this would be for any STI, even the curable ones. All right, so telling your partners, both current and future, okay? Now this goes again back to, I'm not just talking about HIV, but of course it's included in this, okay? It's very, very difficult when you have an incurable STI or blood-borne illness, okay? There's so much shame and stigma that exists around him that makes it hard to be honest. But this is the reason, this fear of being rejected, this fear of being judged, of the stigma is the reason that so many people are just hush hush about it. And this is the reason, one of the main reasons why STI rates continue to rise in the world, okay? They are continuing to rise. So it is essential, please, please, please take this to heart, that you share your STI BBI status with any new partners, okay? They have a right to know so that everybody can proceed in an honest and honorable way, okay? People don't fall in love with what you can do with your body. They fall in love with you, okay? That's really important. Okay, remember, You are your own bodyguard. The 100% best way, of course, is to not have sex. But the second best way is to always use condoms and lube. And you can find more videos like these over on YouTube at Rethink Sex Ed.